Hi everyone, welcome to my page. Today we'll be talking about supplements taken in pregnancy. We're talking about, or can call it hematinics taken in pregnancy. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. I'm a consultant obstetrician gynecologist. If you are new to my channel, we'll discuss everything about women's health, children's health, and sometimes men's health on my channel. So today we'll be talking about supplements taken in pregnancy. If you look in my hand, I have some drugs here. This is folic acid. I have fesolate. I have this vitamin C. So if you go to the hospital, you will see different drugs like this. If you are pregnant, you will see them. I'm not advertising for any company though. You see these drugs taken in pregnancy. They may give you the yellow one, give you the red one, give you the white one. The yellow one may be folic acid. They will give you fesolate. They will give you vitamin C, give you calcium, and some may even go on to give you multivite, the black one. However, I want to burst your bubble a little that the main drugs for pregnant women is actually folic acid, this yellow one. Don't know, can you see it? Yeah, this is the yellow drug, folic acid. This is actually the drug that is used needed in pregnancy, and fesolate. Every other thing that you are receiving is jara, but we have reasons for giving them. Not that if you don't give them, anything will happen. Okay, see the red one. This is fesolate. The red one, I see it. These two are the main drugs required for pregnancy. We'll go through them one after the other. Please, if you're not subscribed to my channel, subscribe to my YouTube page at Dr. Nkiruka Bridget, OBGYN Talks with Dr. Adazion. Follow me on Facebook page at OBGYN Talks with Dr. Adazion. I'm on TikTok and on Instagram with the same name. So let's go on. Why folic acid? This tiny drug you are seeing here, sorry, is really important. These tiny drugs is important for the development of your baby. Now, if you have missed your period and you are sure you were sexually active before you missed your period, you need to start taking this drug because that missing of the period is likely pregnancy, especially when you did not do it with protection. So it's likely you are pregnant and you will need this drug for the normal formation of your baby. This drug, this is folic acid 5 milligram. Now, the recommended dose is 400 milligram, 400 microgram rather. The recommended dose of folic acid in pregnancy is 400 microgram. However, most women in the tropics come down with decreased level already, let me put it that way, in the body. And so this 5 milligram is formulated for our use. It is not abnormal. So, but if you have anything less than 400 microgram in any container that you are taking, it is not good. So this folic acid helps in your baby's brain development and spinal cord. The brain is the house of all the things somebody does. If you want your baby's brain to develop properly, please make sure that immediately you miss your period, whether recommended or not by a doctor. Please get a folic acid, it's very cheap. It should be recommended by a doctor, but this hematinics is very important because most women in this part of the world book the antenatal late in pregnancy. Some of them will be coming in at 7 months, that is 28 weeks. The least you will see is at 20 weeks, that is about 5 months or 6 months. So by then, I may not need this again for proper development of your baby's brain. So within the first 2 months of missing your period, make sure that you have started taking folic acid. I will still come to why you should take it even before you get pregnant. But for those that are already pregnant, make sure within the 8 weeks of your pregnancy, you have started this. Because at that time, your baby's brain has started developing. And yet, that your baby's brain needs folic acid to start developing. If you are in decreased or no folic acid level in your body, that your baby may have a problem. You need this for your baby proper breast development, because if you don't take that, the baby may come with small brain. That's what we call microcephaly. The baby may come with no brain at all. You just be seeing eyeball. That's what we call anencephaly. Or the baby may come with spinal cord problem. we'll call it spinal bifida. That spinal bifida may just be a bump at the back of the head brain, at the back of the spinal cord down, or you have a connection, an opening at the back of that spinal cord. Maybe because it did not take enough folic acid. This tiny drug is taken actually every day, one every day. From the time you missed your period, start taking it. For some women, we need to start giving them even before they miss their period. I'll give you the reason why we give to those women. So start taking these tiny drugs every day of your pregnancy. We'll give it till the end of your pregnancy and even 6 weeks. It is not just for the baby. However, this is very, very important within the first 8 weeks you missed your period for your baby's development, so that that baby will not come with abnormal brain development. So that that baby, because this baby comes with abnormal brain development, for those that have an encephaly, they may not survive. Those that have no brain at all, as they're delivering them, they will not survive. Now, for those that have small brain, they may survive, but with certain difficulties. They will find it difficult to walk. They will find it difficult to be intelligent. They will not grow like others. In fact, they may become cerebrally impaired. You know, brain impairment. You see it in them. Now, for those that have spinal cord problem, because you do not take this tiny drug, this very tiny drug. For those that not have problem with their spine, you will see them, they'll be finding it difficult to walk. They will not be able to poo well. Going to toilet may be difficult. They may not even control their physics and be saying that you are having an impaired child. Just know that it wasn't that baby's fault, it was your fault. So immediately you miss your period, start taking this drug. It's very, very necessary. It is very, very necessary. It's not up to 200 naira per big pack. Like this one, this pack now from this part of the world is 1,100 naira. And you have about, how many tablets here? Okay, trying to 1,000 tablets. You will not even finish it. 1,000 tablets, 1,300. What will prevent you from everlasting torment? Now, we have different brands. I'm not advertising for any brand, just like I've said before. We have different brands. This is another one. 1,000 tablets. And for 900 naira. Is it not cheap? So you start it. You won't even need to buy another one in the hospital. This will also help in building your blood. This also helps in the woman's blood building. So for you not to have what we call anemia, lack of blood in pregnancy, you also need to take it, not just for your baby, for your own self too. You see, it has multi-purpose for your multi-purpose benefits. You take this drug as tiny as it is, and you get what you want. This is about folic acid. So folic acid is very necessary. Don't forget, if you have any container, whether given to you from your friend abroad or given to you from your loved ones that did not buy, and it is not up to 400 micrograms, please, you're not taking enough. I may not do what we want it to do. This is about folic acid. If you have not subscribed to my page, please do so now. Hit the notification button. Follow me on YouTube, on Instagram, on Facebook, or at OBGYN Talks, OBGYN Talks with Dr. Adazion. That is about folic acid. Now let's talk about this. Remember I said the two most important drugs is folic acid and fesolate. This is fesolate, the red drug. You are just supposed to take this drug once a day. Put yellow one, put red one once, you take it. Now, this drug will help build your blood. It will not allow you to go into anemia. Fesolate is very, very important. If you have lack of blood in your system, as a newly pregnant mom, you may miscarry that pregnancy. As a newly pregnant mom, that your baby may not develop well. As a newly pregnant mom, remember your baby is supposed to be a parasite. You'll be struggling with that pregnancy. So this is good for your body. When you get pregnant, these are the two most important supplements needed in pregnancy: fesolate and folic acid. So these are the two most important drugs needed. It will help build your blood to the optimum level. Because if you also lack blood, at time of delivery, you are at risk of bleeding out. So this will help you. So that we don't start running helter-skelter looking for blood to put you. And you be disposed to diseases associated with blood transfusion. So make sure you don't miss this drug. This one, okay, I didn't see the price where they wrote this. I'm not advertising, I'm also saying it. Nobody has given me brand ambassador to these things. So this is about folic acid. Now, remember I said these are the two most important drugs needed. This is what we call hematinics. These drugs are what we call hematinics. Now, when you start seeing vitamin C, this white drug, start seeing vitamin C in your drug. This helps increase absorption. It helps increase absorption of these two. Peradventure, your system has any need that will make it not to absorb well or absorb optimum level of folic acid and fesolate, you add vitamin C. Vitamin C will help increase absorption. Vitamin C is also an antioxidant. That is why we add this white one. When we start adding calcium, when you complain of any bone problem, oh, my bone is looking as if they want to break. Oh, my hand is doing me like this. Oh, this place is paining me. We can start adding calcium to help your bone. That is why we add calcium. So when you come and say, ah, doc, they did not put calcium for me, just know that it is not compulsory for me to put calcium for you. When you now start seeing the black one, except if you complain that you're not eating enough and you cannot eat enough, we don't just necessarily add black one. Remember that these are drugs. So these are the supplements you need in your pregnancy. See? Very tiny one. And you don't need to take more. Just take one daily. Don't take one morning, night. Or they say I should take it morning, afternoon, night. Even this fesolate is once daily. If we want to double it, we can just take one in the morning, one in the night. We don't prescribe 3 times daily. It's not needed. Because the next thing is that if your body will just take the one you need, and the extra one remaining, the body, it will come out in your physics. You may start having increase going to toilet, and your toilet will be black. You'll be thinking, what did I eat? Is it vegetable? Maybe you're taking more than enough. So thank you for following me to this point. If you have not watched my page, if you're not following me on Facebook, please do at OBGYN Talks with Dr. Adazion. Follow me on YouTube at Dr. Kiruka Bridget, OBGYN Talks with Dr. Adazion. I'm also on TikTok and on Instagram with the same name. See you next time for another enriching, beautiful video. I love you. Thank you.